just over half of women here admit that feelings of shame or embarrassment when getting the morning after pill may prevent them from taking it after unprotected sex, increasing the risk of pregnancy, while more than 1 in 10 feel there's still a stigma attached to getting it. Now, Dr. Pixie McKenna is on the line to discuss the issue with us this morning. Good morning.
Good morning. How are you?
I'm good. How are you keeping?
Grand, thank you very much.
Thanks for joining us this morning.
My pleasure.
Lovely. Okay, so why do you think there's a stigma surrounding the morning after pill? You'd imagine in this day and age we're more modern, and the fact that it's even available to us here, that people would be availing of the service.
I think, what this piece of research, which was commissioned by HRA Pharma, is it's just really telling us that actually in Ireland, we might be a progressive country, but we're quite a small country, and we have long-standing relationships with our GPs and our pharmacists, and often that in itself is a bar to us maybe seeking advice or prescriptions on more sensitive issues. So, you're happy to talk to your doctor about your blood pressure, etc. But when it comes to saying, actually, do you know what, I went out last night and I did this, or, I've had a condom failure, etc., you might be a bit reluctant.
Sure, and I suppose from being on the TV show Embarrassing Bodies, you see people, and in all sorts of predicaments when they're embarrassed. How do you think we can make women feel less embarrassed about taking emergency contraception?
I think you should never be embarrassed about taking emergency contraception. Emergency contraception is something that, if there's a medical need to take it, you want to prevent pregnancy, then you've got to look at it in a more practical format rather than thinking, I've done something or I've been stupid, I've made a mistake. Be more practical about it. And remember that you don't have to go to your GP or your local pharmacist if you have known them for a long time. You can go to any pharmacy and they're very competent at dealing with this, and they also can do it confidentially because most pharmacies have a consultation room, so you can go in there, have the discussion, get the treatment, and off you go. And it's purely between you and the pharmacist.
Sure, and you have a pharmacist, Claire Murphy's there with you this morning. Claire, what kind of options are there for people who might want to avail of this service of going into a pharmacy? Do they need to book it, or is there anything like that?
No, not at all. So that's one of the great things about pharmacy, that we're very accessible and we're often open much later hours than your local GP practice would be, late nights, Saturdays, Sundays. So at the moment there are 2 forms of morning after pill available over the counter. So there are, in 2011, Levogestrel became available. So it did, and then just in the last month, Ella 1 has become available. It was previously prescription only, and now it can be available through pharmacy. And that's a really positive thing for women in this country, because Ella 1 is a more effective emergency contraceptive than the Levogestrel. So if you took the example of 1,000 women who had unprotected sex, of those 1,000 women, if you didn't take any emergency contraception, 55 would become pregnant. Then if you took Levogestrel, it would be 23. And with Ella 1, that's down to 9 people in 1,000 who become pregnant within 24, if they take Ella 1 within 24 hours of having unprotected sexual intercourse.
Sure, so they are very effective. I suppose for anyone who might not have taken it before, are there any side effects that they would be concerned about?
There are some side effects, but you find that with most medications there'll always be some side effects. So with emergency contraception, the most common thing is nausea, stomach upset, maybe some vomiting or diarrhoea. And if it was a case that a lady did have vomiting or diarrhoea after taking her emergency contraception, then she needs to come back. Within 3 hours, she needs to come back to her GP or her pharmacist, because there is a chance that it may not have been fully absorbed into the bloodstream. As well as that, you might have a change in her cycle, so you might find the next period is a little bit earlier or a little bit later than she would have expected.
Okay, so I suppose, what advice would you have for someone who finds themselves in this situation? The first thing they should do straight away?
I think that if you get emergency contraception as soon as possible, like we call it the morning after pill, because we really want ladies to avail of it within the first 24 hours of unprotected sexual intercourse. So come into your pharmacy. It might be a case that you may not want to tell the person who's at the medicines counter that you want to avail of emergency contraception, but you can just ask to speak to the pharmacist. When you go to the pharmacy, so we're Allcare Pharmacy, we have 70 pharmacies throughout the country, and we have consultation rooms in all of our pharmacies. So the pharmacist will bring you into the consultation room, so it'll be completely private, go through a few questions with you, just to make sure that the emergency contraception will work for you and is the appropriate choice. And you can take your emergency contraception there and then in the pharmacy if you wish, or you can bring it home. But the most important message that we have for ladies is come into the pharmacy as soon as you can and let you know the different options that you have available.
Sure, and if anyone wants to find out any more information, have you an online service?
We do indeed. So if you want to find out some more information, you can go to hra-pharma.com and it'll have all the details of the emergency contraceptions that are available.
Perfect. Pixie and Claire, thank you so much for chatting to us this morning.
Thank you.
Thank you.
Thank you.
So what